last night and said, hello, I need help with my nonverbal 4-year-old. He recently lost his younger sibling due to a car accident.
Oh my gosh.
I'm noticing an increase in tantrums, meltdowns, crying, and biting. I think he's grieving. How do I help him deal with his grief? We don't know what or how much he understands. He functions at an 18-month-old level. Thank you so much for your suggestions. And I have to start by saying, you know, obviously you have suffered a loss as well.
Oh my gosh, I'm just so devastated by this entry here.
Yes.
I can't even imagine what you are going through, and God, you are a strong person, and may the universe give you much more strength to handle all of what you're going through. And if there's anything we can do to help, please call on us to do that. It's very difficult, I can imagine. First of all, I really commend you for putting your child's grief ahead of your own. And that is not an easy thing to do. And as parents, we all hope to be able to do that, but we're never put to the test. So, you know, congratulations to you for thinking of your child first in this case. There's very little that you can do, obviously, because you don't know necessarily what your child is going through. But of course, if we are any person who's going through grief, I would imagine a few things. First is just fill his activities. Is it a boy, right? Yes. Fill his schedule with activities. Keep him busy and distracted. That would be probably a very important thing to do. And because you don't want to add additional demand or make things harder for him, I would suggest that you fill the activities with fun and easy activities right now. And I think if you really do that, that's probably the best thing you can do. In other words, your child will now be engaged in fun and easy activities all of his waking hours so that he is able to be distracted and be rewarded. Really, other than that, all you can do is hold him, give him a sense of security. He most likely is missing the presence of his younger sibling. And so it will be very important to give him a sense of security. A lot of young children will attach to perhaps a stuffed animal or a blanket or something that helps him feel more secure. I would avoid going to new places, doing anything new that's out of his normal activity level for a month or two, because anything new causes additional anxiety. And so just providing an environment of safety and security and keeping him busy with fun and easy tasks is probably the best thing.
I'm just wondering, I know one of the things that they recommend for adults with grief is, because you mentioned activities, they particularly recommend physical activities as a way of getting the emotions up and moving, and that adults will sometimes, exercise, and then that gives them, that level of tired gives them release, and sometimes they'll cry afterwards. Would we recommend the same thing for kids?
I would imagine that physical activity can only be helpful in this particular time, although I don't know the child and I don't want to force him into anything that he doesn't enjoy. Dance, music, that sort of thing might make it more fun of a physical activity. But yeah, I'm aware of the fact that with adults, we tend to release some emotions after physical activity. I'm not sure if he's holding back emotions because he already has meltdowns and tantrums, crying and so on. So I would hate to enhance that and increase that, but you're going to have to bear with it for a little bit.
Yeah, bless his little heart, and we
and
wish
yours,
our best to you and to your entire family as you work through this.
Absolutely.
And do let us know if there's something that we can do to help. Going to move on to another question here. Hello, Shannon and Dr. Doreen. As always, love your show. You guys are amazing. My son is 4.5, is language delay, but slowly improving on his speech. His tantrums and meltdowns are out of control. It's getting harder to deal with his tantrums and behaviors. When on a timeout for hitting, or when he does not get his way, or sometimes we don't even know why, he becomes very mad, hits, breaks, and throws things. It has become unsafe with other others or himself. I end up sitting with him many times, now blocking him to avoid hurting others, but I end up all beat up since many times I've held him down as he is screaming since I can't block him, since his meltdowns are too severe. Am I wrong by holding him at this point? I used to walk away, but now I return since he goes after us anyway. Waiting on ABA, so we love that you're moving in that direction towards getting ABA, but they write, what can I do for now? This is hurting us all physically, but mainly emotionally. They say, please help and thanks.
Right. That's a tough situation, and I'm very sorry that you're going through such a difficult situation right now. I would suggest that you do not hold him. I don't think it's productive. I don't think he will aggress towards himself or hurt himself if he is alone. I do suggest that you walk away and do not allow him to escape, to come after you. So I don't know the exact circumstances of the room and where this is occurring and if it's in public and so on, but let's look at the scenario a little bit closer. I mean, you're saying when he does not get his way, and sometimes you don't know exactly why. The times when you don't know exactly why he's hitting, the only possibilities are that he's not getting something. It could be an object, it could be something he wants, it could be an activity he wants, it could be avoidance of an activity. So there's some reason that he's aggressing, and usually we want to try to find out what that is, obviously, because if there's some other form of communication, then aggression will reduce pretty significantly, because why would you aggress when you can communicate that you're upset about something? So by what you are doing right now is you're holding him down and he's screaming, and in the meantime he's having this huge meltdown and he's injuring you, and it's not a good situation. So imagine if what he wanted, and we don't know, but imagine if what he wanted is your attention. And when he screams, you go over there and you hold him and you're giving him tons of attention. So the message he gets is, this is a pretty effective way of me getting this attention. And the behavior will not only continue, it'll increase, because you're essentially rewarding the behavior and saying, any consequence that follows a behavior can either act as a positive consequence or a negative consequence. And the fact that you're holding him, if it was a negative thing for him, the behavior would end. But since the behavior is going on, I can guarantee you that he's not disturbed by you holding it. In fact, he's enjoying you holding him to some extent. So, and that's why the behavior is increasing and continuing. So it's not working. We need to change what we're doing. And the best thing to do is to actually not give him attention. And the best way to do that is to walk away and prevent him from escaping, which means you hold the door. You have to wait until he calms down. If you're concerned about his safety, place a camera in the room. So that you can look at the camera the minute you go outside. It's very important to, this is the general rule, you do not give what the child is trying to gain by doing that inappropriate behavior. And that's your first step. You do not give what they're trying to gain. So if he's trying to gain an object, you prevent him from getting the object. If he's trying to get attention, you don't give attention. And the second step then is to teach the child a different approach, a different way to communicate, and then give him what he wants. And that different approach, that different way to communicate has to be as easy as or easier than the tantrum and the aggression. So it has to be something very, very basic. And that could be something like the picture of an icon on the wall, and you touch it, and then the child he touches it, and then he gets whatever it is he wants. You must figure out what it is he wants. When you get an ABA specialist in there, then they will do a functional assessment and figure out exactly what he wants. Until then, I would say your best bet is to not give him attention.
is a hard time.
It's a very, very difficult thing.
We talked yesterday on the show about the period of time in which you're waiting for ABA to start. And that there are so many things that are hard along the way. It's hard getting a diagnosis. It's hard having a team of people in your home. The waiting, I have to say, is the hardest part.
It's horrible. Yeah.
But I'm so glad that you're using this forum, that you're asking the questions that you're asking, because you're going to be that much further ahead of the game. If there's any way that in the meantime that she can get some help and support so that she can follow through on these things,
exactly.
I just feel like
so that would be, of course,
yourself.
IBT.
Yes.
So what we really recommend is that you should go on the Institute for Behavioral Training website, which is ibehavioraltraining.com, and please look through there. There's a whole section for parents, and you will go through, and there's modules, and there's lots and lots of modules. And I think the parent section is actually the most busy or loaded section. So just pick modules, and I would really recommend the behavior module, which teaches you how to manage challenging behaviors. This is so important. It's not just that you're going to be changing the behavior before your ABA team gets on board. It's just that regardless of what you do or don't do with it, any understanding you have of ABA and how the techniques of ABA work and how they change behavior will help you even when the ABA program starts. So as Shannon said, it'll give you resources to do things now, but it'll also make you into that fantastic parent who understands and can follow through and actually make the therapy better once your program starts. And let me tell you, I think for parents, it's not just the fact that you are engaged and so on. It's just it'll make you feel better, because it's almost like you learn a language that your child speaks. So it's kind of like now you can communicate with your child, and the anxiety about not knowing what to do is gone, and that wall of like, why is he doing this? I don't know what to do is gone, and you'll know what to do, and it'll be very, very, it's a good thing for parents when they're trained. It's a very empowering feeling.
If I could give you one thing right now, I would say to you that this moment in your life is not going to go on forever, that you're on the cusp of this part being over. You're going to have to walk through some difficult stuff, but know that this is not going to last forever. And I would encourage you to find someone, whether it's your significant other or another family member or a really good girlfriend or a college student that you can hire, but get an ally for now and so that you can have somebody when you that will give you respite later on when you're getting ABA going on. Mm-hmm. But you can have them do the IBT trainings with you. IBT has a very exciting announcement next week about making this training available to everyone in the month of April. Mm-hmm. I can't give anything away until next week, but it's very exciting. And I think life-changing for a lot of people. So I want you to know help is coming. It's there for you now as much as you want to do it. Get an ally so that you can get through this period of time. But this won't last forever. It's going to get better.
Yes, absolutely.
We've got somebody who's written in and said, hello, my 2-year-old shrieks and screams when we are not playing or feeding him. He doesn't have any words yet. It's driving me crazy. Mm-hmm. Sometimes it's out of frustration, but I think he also likes the sound he is making. Mm-hmm. How can I teach him to be quiet? Can I teach a nonverbal toddler to ask for my attention? And thank you so very much.
Yes, you can. I would say it's a little bit more difficult if you don't know for sure when he's screaming or shrieking. If you don't know for sure if he's doing it in order to get food or in order to play. But initially it's going to be a little bit confusing. But here's what you do, and this is not, you don't do this when he's screaming or shrieking. You do this separately, so when he's calm. So you will sit him in his chair, and you will have one picture of him and his favorite food, maybe eating his favorite food, and you put that picture in front of him, and then you will model for him or prompt him to touch the picture. And as he touches the picture, or even to give it to you, whichever one, and once he does that, you will give him a bite of that favorite food, okay? And you'll do this 20 times, and then the food is finished. But every time you want to give him a spoon of the food, he has to either touch that picture or give it to you. Okay, and you'll do that, and that's that. The next day, you will come back and you will do that again. And you do that until he gets to a point where if the picture is just on the table, he will, and you have the food in your hand, you don't have to prompt him anymore. He now gets it that, oh, this picture, if I touch the picture, they'll give me that food. So you do that repetitively a few days until he gets that message. Now, and it could take a while, but keep doing it. Now, once you've done that, you will now come with a new picture. And this now will be a picture of him and his favorite toy that he wants to play with. And so you will now have him really look at the picture, and it should be different. He shouldn't be seated the same. For instance, he should maybe on the ground. Very different. Make the picture look quite different. Could be in different size as well, different colors and so on, than the eating picture. Okay, so it makes it easier for him to discriminate. So now he will touch that picture or give you the picture, and you will play with him. And you'll do that now for a few days. And once he's mastered that, then you will rotate the two. And this is what's called random rotation, and that's the hardest phase because that's discrimination. So now what you're trying to teach him is that you'll have both pictures, and you'll say, if you touch this one, I'm going to feed you. If you touch this one, I'm going to play with you. And that's a little bit confusing. It is a little bit hard. So there's a lot of different ways to do this. We do it in 7 steps, and that's called discrimination training steps. So what I would suggest is, if you want to learn those steps, you can go to IBT, Institute for Behavioral Training, and look up the skill teaching module, and it will take you through those steps, and it'll tell you exactly how to introduce the first object, what we call the target, which is that, let's say, the first picture. And then you will bring in distractor pictures, and then you'll bring in the second target, and then you rotate the targets. And this sounds like technical lingo, but it's basically what I just told you. And the idea behind it is that you're now teaching your child to touch an icon or to hand you a picture instead of shrieking and screaming in order to get their needs met. And it's always, I'm glad that you figured out that he does it because he either wants to play or he wants some food. And so it's important to figure out, to, give him a way to express which one it is he wants, and then really reinforce that.
Okay, wonderful, wonderful advice. And then please write us back and let us know how that goes. We'll be very interested to hear.
And by the way, you also added, can I ask a nonverbal toddler to ask for attention? Attention is quite different than wanting to play or eat. So, and yes, of course, you can do that as well. And the way you do that is just teach him a third icon, which is a picture of you. And you playing with him, perhaps, or you doing something with him that he likes. And then that's what he will learn to use.
Yeah. And it's so powerful and such a lovely thing when they get the ability to ask for that, and then we reward them by giving it to them. It's so powerful.
Absolutely. And these picture systems or just augmentative devices or nonverbal communication devices, and the whole system, we teach our nonverbal kids pretty much everything nonverbally. And it's fabulous. There's no limitation on this. Like one of my kids, I often talk about, does all sorts of stuff. I mean, and he started out with exactly what I just told you, single pictures, single icons. In fact, when I met him, he had maybe a handful of icons that he wasn't really using, even though they were attached to him. And now, of course, he types full sentences and descriptive sentences on his iPhone. So he doesn't even, he's gone all the way down to just carrying a phone.
And I will tell you, too, that if you start to do picture exchange, someone in your life, well-meaning mother-in-law or someone is going to say, he's never going to talk if you do that.
Right.
And you should be fully armed and ready for that moment, knowing that all the studies show that the exact opposite is true.
That's right.
Kids on the autism spectrum are more likely to speak quicker, not all of them, right? But the ones who are going to speak are more likely to speak quicker if we have functional communication, such as a picture exchange system.
Augmentative stuff, yeah, absolutely.
On board.
Because not only will their frustration level go down right away and they will be more attentive and more willing to learn, but also it's a prompt. I mean, you can also consider these visual stimuli as visual prompts.
Yeah.
So they're prompting the child. You never have to think that a vocalization cannot be accompanied. It certainly can accompany instead of giving you a picture, he could also give it to you and say toy or whatever it is, or food. But right now, you're going to teach him one thing at a time, and you're just going to teach him to give you the card. Later on, you can pair it with a verbal.
Yeah, it just makes sense, too. I always think about if aliens came and took me, I don't always think about this, but if aliens came and took me to another planet, and they had a different way, they didn't have fingers, and they had a different way of communicating that I didn't understand, very quickly I would have needs. I would need to use a restroom, I would want something to drink, and I would want something to eat, right? And I would tantrum. I would start screaming and kicking people and biting people if I couldn't get those things and if I couldn't figure out their mode of communication. But I would learn their language much quicker if they gave me some way to communicate with them so that I could get my basic needs met. Right? I would be able to learn because I wouldn't need to use a restroom, wouldn't need something to drink, and wouldn't need something to eat. And that's me. So imagine a 2-year-old, and because this is a new planet to them.
Let's hope that never happens to you.
I'm never going to be, I don't believe in aliens. I'm not somebody who's looking over my shoulder for an alien abduction. That's not who I am.
They're all around you anyway.
I hope not. In any case, let's move on to our next question. Hi, my adult son is very verbal, but sometimes bites his arm when we take him places he doesn't want to go. How can we stop this when sometimes we have to take him with us? And thank you so much for your help.
Yes, so, essentially that is some form of, it's a combination of things. So on the one hand, it could be just frustration, obviously, and then it also becomes a habit. So habits are learned behavior, So let's say, I'm trying to, okay, here's a good example of how this kind of thing. So you have to kind of try to identify what is causing the frustration from these social places. Is there something in particular? And with our kids or adults, they have different things that make them anxious, I think. So let's look at an example of us, what we do, which is very similar. So let's say you go to a party, right? And it's a pretty chaotic, noisy, active party, and everybody's drinking and partying and all this sort of stuff, and that's an environment that may stimulate to you to, for instance, have a cigarette. Okay? And that's not necessarily a good behavior that you want to practice, but generally speaking, being around others who are partying or being in a socially anxiety-provoking environment, you might pull out a cigarette. Okay. Now, why do you do that? Probably because you are used to doing it, so it becomes kind of a habit in that environment. Other people are drinking and smoking, so you might as well. Secondly, because people exhibit those types of behaviors because of a little bit of social anxiety. It's like something that will calm you down a little bit,
yeah,
right?
They call it a social lubricant.
Exactly.
Some people use alcohol.
Exactly.
Other people use a cigarette, and some people use food, and it could be any one of a million things.
Exactly,
right?
Exactly. So those are perfect examples. Now, in your son's case, something in that environment is causing him a little bit of discomfort, which could be some form of social anxiety, frustration, or so on. So figure out, first of all, what's common about these environments? Is it actually an environment that is provoking social anxiety, in which case you want to give him something else appropriate to do instead of biting his hand, which has his arm, which has kind of become a habit. And if it's not socially anxiety provoking, maybe it's sensory anxiety provoking. So usually our kids tend to escalate in these types of behaviors when there's a lot of sound, noise, which is really piercing and disturbing. Maybe it is visually overwhelming for him. Maybe you have to really kind of look at the environments and see what they have in common. And I don't know if it's every environment, or maybe it's just environments where you're busy doing something else, and this has become his way of getting your attention back on him. Try to figure that stuff out, because there's always a reason we do these things. It may not be evident because the behavior has really nothing to do with the environment, like why bite his arm versus anything else. But I can tell you that he's trying to communicate something. So try to block it as much as possible. Here's an idea. Try to maybe in the location. And by the way, one of the things our adults tend to do is once they bite a particular location and it scabs over or it toughens, that it becomes the location where they keep going back to. So I would try to maybe wrap that location. There's a lot of different kinds of these, not even with bandage, but they have these socks that you can pull up that are like elastic. And I think if you cover that area, he may gradually stop biting that area, because the sensation, he won't be able to feel it as much. And by doing that, you're blocking it, but you do need to teach him some other way of coping.
Okay. The sock things, I have sleeves that I put on because I'm very sun sensitive and I don't always want to douse myself with sunscreen. And they're just sleeves that you can take on and take off. They're a little bit compression, and they actually help with anxiety too.
Yeah.
Because they're a little bit of, in some people, not in all people.
Yeah, they're kind of fun. Yeah, I like sleeves too. I kind of sometimes get overly anxious because they're so tight.
Yes,
like the
you don't want them
compression.
too tight.
But the feeling of any kind of brace is sort of a anxiety reducing type of thing. It is a centering thing.
Yeah, they're kind of spandexy, and they come in all different colors. You can get them in all different, and they're literally the sleeves. They don't go up to the shirt so that if it's hot you can take them off. I have one with butterflies.
Oh, nice.
It's very nice.
Yeah, I had one that looked like tattoos.
Oh, very fun. Cool. Yeah.
But you should also try to keep him engaged. Like if you're preventing the behavior, really try to keep the individual engaged in other things. Shorten the duration of time that you're going to these things. Give him plenty of breaks. It's all the same rules. I mean, if you think about it, it's all the same rules. Reduce the difficulty level is what we're saying, and gradually work up again.
And I wonder too if your adult son is at all interested in the technology end of things, because I find that a lot of my son is very much in this category. A lot of our kids, they crest to a certain age, and very similar. It's very neurotypical. I see all kinds of young people, and their social lubricant is their phone.
Right.
That they're busy texting, and that way they don't have to attend to certain things that are making them nervous. That can, it's a terrible but good thing. I know that my son can be entertained for hours on end. You could stand him on his head, but if he had a piece of technology, he's fine. I could go shopping, and fly around the world, and he would be happy to have his phone. So something to consider. Right. We've had a lot of people writing in. I didn't get to fill Dr. Granpeesheh in on all the conversation, but somebody wrote in this morning and said, what do you do when ABA does not seem to be working? What other methods would you recommend? Lots of conversation on Facebook, and at least one person writing it in saying, well, that's a very interesting question, because ABA should work, that it's something that's if it's individualized, that at some point that it should be working. So I'd love to hear from you, a true expert in the field of autism. This parent is saying, what other methods can I use when ABA is not working? Right.
That's a really great question, and it's a fabulous topic for discussion. I'm glad you asked that question. So, to some extent, ABA should always work. Yes, that's true. So, but it doesn't always work, and we'll talk about why and some of the reasons and some alternative things that you can do. But what is ABA? It's not a magic pill. It's a technique that we know for sure works not only with individuals on the ASD spectrum, but all people. Okay, so it just works in general, because it clarifies those basic rules that govern behavior, and it allows us to practice in a way that we can change behavior. So ABA is an effective tool. There's no discussion about whether it's effective or not. It's a highly effective tool. There's no question about that. Now, there's a few things about it that need to happen so that it is effective for any given person. One thing is, it has to be done enough. So if you do ABA 1 hour a week, or if you do ABA 5 hours a week, it's going to have very little impact on your child. Because, hey, we've done studies on this. Thousands of studies have been done, and it's very clear that you need to intensify your efforts. It's like learning a musical instrument. Good example. If you do 1 hour of practice with a musical instrument, it'll take you maybe 15 years to learn your first song. Whereas if you do repetitive practice, you're going to learn a lot of different songs and you're going to learn a lot of different instruments over the course of 1 year or 2 years. So the more you put into it, the more you will get out of it. And so intensity is a huge factor. Duration is also an important factor, and that means that you have to do it long enough. So if you do a heavy intensity of something for 1 week and you give it up, the behavior change won't maintain. So it's very important that certain key features are done. There's enough hours being done, and that'll vary based on each individual. There's enough intensity, there's enough duration, so it's being done long enough. The third factor is it needs to be quality ABA. So you can be trained in ABA but not really know what you're doing. The certification, I see too many people out there who have learned ABA kind of in a very theoretical or academic manner and don't really know how to apply it to people. A lot of times, actually, people who come to CARD tell me that's the one thing, they learned from CARD how to apply these things they had studied and learned about. So I really, encourage you to make sure that the quality of the ABA that you're receiving is high quality ABA. Like anything else, you can go see a dentist who will mess up your tooth, or you will go see a dentist who will completely take care of it and do a good job. You need to make sure you have a very competent practitioner. So those are the first three things: the duration, the intensity, and the quality of the program that you're receiving. Now, if you have all of that, there's also other factors that might influence whether or not it works. For instance, how healthy is your child? If your child is not sleeping, obviously, no matter what effectiveness that any technique has, they're not going to be focused enough or have the physical capability to learn. So your child needs to be sleeping well. Your child needs to not have pain. So we want to make sure that we're looking at all the other things, like, is my child having pain in their stomach or other areas that might be conflicting? We want to enhance the child's attention, because ABA is, after all, just a teaching technique, right? It's a technique to change behavior. But if the child isn't attending, if the child is extremely, same as being sleepless or just kind of like hyperactive or zoned out or lethargic or not attending or those types of things, it's going to be harder to get through to them. So anything that you can do that will enhance your child's ability to pay attention is going to be effective and helpful and make the effectiveness of the ABA pronounced much more. So make sure your child is sleeping. Make sure they don't have any illnesses that you're not able to, that nobody's treating. Make sure they don't have pain. Make sure that they are able to attend better. And there's, you can modify that through biochemical means, medications, diets, all that sort of stuff. They help the child stabilize, sit down, and be able to pay attention better. So all of those factors have to be present in order for ABA to work. I won't say that I recommend another type of technique. I don't. Obviously, I've put my entire life into this technique, and I've trained in a lot of other techniques. I am familiar with floor time and how to do that. I am familiar with I trained even in things that I didn't believe in, just so that I could make sure that they're not valid, like facilitated communication. I mean, I studied a lot of other things as well and came to the conclusion that ABA is the one that works in terms of a teaching technique or a behavioral technique. So, but I also know that a lot of my children suddenly wake up and do much, much better if they're on the right diet, if they're sleeping well, if they're able to attend, if they're not in pain. So I'm a very strong believer that you need to make sure that you're treating all of the issues that the child is suffering with and not just trying to teach them skills. So that all has to come together. And if you do all of that, you will see some response. This is not about the child's capabilities. Children have capabilities. It's just a matter of facilitating it for them.
I just want to add one thing to what you said that I see as a really important component of all that too, that checklist, is that the parents have to learn these techniques and be as involved or more involved than the people who are delivering it.
Right.
And I just want to say how important it is, and this is a subject, I love every single parent that's out there and has a child on the autism spectrum and is trying to figure it out. And I know how hard it is, and it's part of the reason why I am in this chair, the hours that I am to help you to get to the answers that you need. But you have to be aware of who you listen to and when you listen to. There are parents out there who will gleefully say to you, we did ABA and it didn't work. They didn't go through that checklist that Dr. Granpeesheh just gave you about, were we making sure that it was quality ABA? And imagine if I were to sit there and to tell you about a world-renowned diet program that people have been losing weight on for years and years and years, and I said to you,
Great
I
example,
went on that and it didn't work.
Right.
But if you asked me, did I really learn how to eat that way and did I really follow through on it? If I was going to be honest with you, I would say to you, well, clearly not.
Yes.
Right?
That's such a great example, Shannon.
And
right
parents
there.
are out there who didn't give it the college try because maybe they couldn't.
Right.
And I understand that not everyone can, but don't be misled by them into thinking that because they couldn't do it, and no judgments. If you can't do it, you can't do it. But if they couldn't do it, then they don't get to say it didn't work.
Right. Exactly.
That's not fair to any of us.
That's right.
But I see that when parents say, we made this a priority, I learned everything that I needed to learn, I found out what good quality ABA therapy was, I didn't look at my child as the problem, we looked at how we were teaching my child. All of those parents see real progress. Does it look different on each one of those kids? You betcha it does, because they're all individual. But it's so important that we start cutting people off who are putting out bad information and saying, oh, it didn't work. Ask them, can you honestly say that you gave this the full try? I think you'll get a different answer if they're going to be honest with you.
Yeah.
And if they're not being honest with you, go where people will be honest. Go to people's houses and see the difference that this therapy makes when you go all in. But you have to go all in.
You have to go all in. Thank you for saying that. I mean, and it's so important to hear those words because, truthfully, the worst thing for us as professionals is to see a parent who gives up when they shouldn't, because so many children benefit. Just think of this. This is not, the next diet. That's a great example. This is something that has been approved by every major source in this company, and there is a reason that it's been approved. It is not easy to get a treatment to a point where you have medical insurance, health insurance paying for it. It is clearly an effective technique, and it just needs to be done right.
And don't listen to people who say, well, because listen, everybody's discussing this on a frequent basis now. ABA has a lot of people that are saying, oh, well, but not for all kids.
Right.
That, well, it worked for them because their child was high functioning, or, oh, it worked for them because their child was more profoundly affected. I find it interesting that they argue on both sides of it. The truth of the matter is that one of the reasons why we talk so much about ABA is that if we give all of our kids an opportunity and we are modifying to them, to their individual, then all of our kids, no matter where they come in on, will make some amount of progress that is meaningful.
That's right.
Meaningful. So don't listen to people who try to tell you, oh, no, stop doing that or don't bother doing that. It only works for some kids.
And it has a lot to do also, now that we're discussing it, the content is very, very important. There's no question the techniques are effective, but the content is also is extremely important in how your child does. So, on that discussion of it only works for lower level kids or higher level kids or whatever it is, as long as you know how to, or a professional who's working with your child knows how to modify and teach, whether it's low level or functioning or high level functioning, it doesn't really matter. The content is quite different. When I teach a child who's, let's say, very young and very affected with autism, I'm going to be teaching them pretty basic stuff. I'm going to be working on getting rid of bad behaviors. I'm going to be working on teaching basic requests, basic labels, very easy stuff. When I'm working with a high-functioning kid who's, 3 years into an ABA program and I'm trying to mainstream him, then I'm working on a whole different set of things, and I'm teaching him how to recognize social cues and how to tell jokes and how to enter a conversation with a group of other children. So the content will vary, and please be aware of that, because one of the things that I often see is parents coming to me from other organizations where the child is very high functioning, yet they've been doing rote, repetitive, early content, and that is also a part of the provider's quality, and you have to make sure that your provider is able to provide you with a very broad curriculum of things and that they are specific to your child. Like, I'm not going to teach your child something they don't need just because I need to do it, So the individualization of the whole program and the fact that it is broad and covers all areas of functioning, extremely important, very, very important as well. And that goes under my heading of quality of program. So yes, these are all the things that you have to pay attention to, but I guarantee you it works. There's no question.
Yeah. I'm smiling because sometimes you guys write in, and you write in just enough so that I can identify if you've written in before. And I get to know all of you. And and this person let us know their name. And this is one, I say one of my favorite autism moms, and I have so many favorite autism moms. But so loving that she wrote in. I'm not going to post the question because her name is there. But she says, my son will be starting middle school next year. I can relate to this. She says, the many anxieties I have about that is enough to fill the Grand Canyon. Oh, girl, can we talk? But my biggest anxiety about that is gym class, of all things. She says, I'm worried about him remembering to put his belongings in his locker, remember his combination, undressing in front of the other kids, not understanding the rules of the game they play, and getting picked on, and just getting picked on in general about his little quirks. It makes me sick to my stomach to think of him as a victim to these things, or worse, that I just don't even want to go there. He has an IEP and is in a special day right now. I know that he will be in a public middle school that has an AUT program, but I don't know how to feel at ease with all of this.
This is fabulous. And I don't know really the functioning level of your child, but I'll make some suggestions here. One suggestion is you listed some of the very key things, so work on those. These are things that you can actually teach him. For instance, make it very, very easy for him to open his locker or lock. One of the things our kids have to do is learn how to do a combination lock. Right. I don't know if that's the case here. Make it really easy for him. Practice it right now. Go after school or something and practice the lockers. And teach him each of those skills, changing into PE clothes. Practice the routine. Make it really fluent for him. And you can practice it first at home in a made-up scenario, and then do it at school and make it actually very easy for him. You can use the summer to do that. I don't know when this is next year she's worried about, right? Yeah. So, practice each of those steps individually and make them strong. But then in addition to that, so this is something to consider, and I don't know, but it's something depending on the class and the school. You might talk to the school and the teacher if you think this is something that you'd like to do. And again, it depends on the functioning of your child, because sometimes when our kids are, there's two sides to this. We don't want to stigmatize our children and necessarily label them when we don't have to. But sometimes there's a benefit to that, and the benefit is that other children can be brought on board to be your allies before they take a bullying type position. They're children as well, and they can be manipulated, and their behaviors can be modified. So one suggestion, and some parents have done this and it has worked rather well, is with, of course, the school support and the teacher's support, you actually bring together the children who will be in the classroom. You perhaps can have access to them even in the summer, and form a team called, Friends of whatever your child's name is, and have a few allies in the classroom whose job it is to make sure he is not bullied. And I guarantee you, no matter the size of the classroom or the school, or if it's public, private, whatever it is, there's going to be a few kids who are strongly against bullying and who are already the type of children who will be your allies. And it's a matter of making it a public cause and making sure that the whole classroom knows that, you know, you are aware of what could happen, and that they should instead of making fun, there are ways for them to help. This is something really important, I think, with bullying. People make fun of and bully when they don't know what else to do. And I think if other children in the classroom know a little bit more about autism, there was a group of moms in Arizona who used to do this, and I loved their program. They would go to school by school and teach the school what autism is all about. Mm-hmm. I really, really like that concept, and I would love to help somehow grow that in the country. But I think that if you had the ability to go in and actually explain how your child sees the world, you know, autism doesn't mean that you're dumb or retarded. It means that your brain works differently. Wasn't there recently a research project that came out that showed that, this was like last week, I think, that showed individuals with autism have the same genetic composition as high IQ individuals.
Yes, exactly.
Which is kind of an interesting study, and I love those studies because our kids can certainly use whatever resources we can give them, so that people don't look at them in sort of oh, he's going to be weird in our classroom or something, but rather they start to look at our kids more like, you know, the future Bill Gates of the world, right, the future Einsteins of the world. And you need to help the other children learn that. You need to help the people in the school see autism as that, and understand that your child has gifts and has a lot to offer, and that it is their job, it is their responsibility to society to help your child rather than hinder him in any way. And I think so, put some effort into that, because you'll be surprised that there are some pretty cool kids out there who will be very supportive of this cause.
Yeah, I've been asked to speak week after next at a school, get the school ready for World Autism Awareness Day.
Wonderful.
And if you already know what your junior high is going to be, it might be that you could go in this month during April to give a talk. And I know this mom is very well spoken, to maybe grease that.
That's fantastic.
To start the process of the school knowing it. I love your idea, because I'm going to institute that for Jem as well. And I thank you for writing in about this, because while I have anxieties about everything having to do with junior high, it had not occurred to me to have anxiety about this particular area, right? Now it has occurred to me, but I have tools, I have things to work on. I hadn't thought about, the whole idea of, the whole undressing and locker.
It is kind of a different thing for the kids. I remember with my kids when they entered middle school, it was new, you know, and it was like, oh, I need PE clothes now and all this sort of stuff. So it is kind of a different experience, and you just need to make the child comfortable with it.
Well, but I applaud you for writing in and putting that on my radar. And thank you so much for doing that. I think our kids are going to do that much better because of it, and thank you.